I Good afternoon, everyone. Thank you for joining us. I would ask if you can to mute yourself while Elliot's speaking, and we will have a Q&A at the end. Um, my name is Amy Chickles. I'm with ALS United Connecticut and appreciate you all for joining us today. I'm going to briefly introduce Elliot Sloyer. Um, he was born in New York, but currently lives in Stamford, Connecticut, and has for a long time. He spent about 25 years working on Wall Street. After that, he founded an internet startup. And after that, he founded Wheel It Forward, which he's going to talk to us a little bit more about. He has written 2 children's picture books. He has biked across most of the United States with his children. And he is here to talk to us today about Wheel It Forward, which currently is, I would say, I guess, headquartered in Stamford, but also has uh, a building in Bridgeport as well. So I will turn it over to Elliot. Thank you.
Thank you, Amy. Thank you and your team for this opportunity. So as Amy said, my name is Elliot. I'm one of over 100 volunteers who helped start and launch and run Wheel It Forward. We call Wheel It Forward as a new kind of library. We don't lend out books. We lend out durable medical equipment, things like wheelchairs, crutches, hospital beds, Hoyer lifts, knee scooters, shower safety equipment at no cost. And basically, a few people on our team were inspired by an organization in Israel that started 40 years ago. It's called Yad Sarah. And whether you're rich or poor, whether you're Jewish, Muslim, or Christian in Israel, if you have a short-term or a long-term disability, you will likely go to them. You will borrow equipment from them, and you will return it when you no longer need it. And I came back after seeing that and put together a great team, did a very deep dive on what is going on in this space in our blessed country, both locally, regionally, and nationally. And what is going on in America is largely what are called lending closets or loan closets, which is an idea and a term that's over 100 years old. And a concept, wouldn't it be great to have a closet in a community where people who no longer have a need for home medical equipment can put stuff in the closet, and then if you need things, you can go in the closet and take them out. And again, that's the lens through which this idea has spread across our country. And you'll very often see faith-based groups. You'll see a couple of people getting together wanting to do good. And this is very low-hanging fruit of doing good. They're typically located in sheds, sometimes self-storage lockers, very often in closets, literally, like in a senior center. There's a woman in Norwalk who has a Facebook group, and she posts, leave stuff on my front lawn. I will sanitize it and I will get it to people in need. And what we say is that is everything that wonderful woman, blanking on her name, that she represents everything good about this space and everything that's kind of wrong about this space. So we launched Wheel It Forward about 3 years ago during the pandemic, and we positioned it as a community library, and we are building it to scale. The issue with the lending closet concept is most of them are simply not big enough. There's a wonderful group in Hamden, Connecticut. They have a storage locker that's 10 by 12. They have a wheelchair there. They have 10 canes. They have 2 shower seats. They have a knee scooter. They have a couple of things, but it's just not big enough to meet the real opportunity of the tremendous supply of lightly used equipment and the even greater demand for this life-changing equipment, which keeps people mobile and safe. And so As I mentioned, we launched Wheel It Forward about 3 years ago. We lent out 3 things the first month, 10 things the next month, 30 things the next month. We're now lending out between 400 and 500 items a month. We have about 600 people reaching out to us every month to either borrow or donate equipment. Um, we use technology to track data, to track our inventory. We treat it like a real library. Um, and, you know, from that data, you can learn a lot. And the lending closet industry, as it's been built out across the United States, is not, as I mentioned before, they're not big enough, but they also don't tend to track information. And, they can't tell you at the end of the year how many shower seats they lent out and how many wheelchairs they lent out. And there are things to learn from that data. One of the things we're most proud of is that we've never needed to say no to anybody for basic durable equipment. It's roughly 10 categories of equipment, whether it's different kinds of wheelchairs, shower safety equipment, scooters, crutches, Hoyer lifts, hospital beds, things like that. We will always have that equipment. And what our team had discussed before we started was, what are the odds that the supply of lightly used equipment in each category would meet the demand? And sure enough, once we started, we realized that we couldn't keep up with demand for transport wheelchairs. Those are wheelchairs that are lighter, they have smaller back wheels, easy to throw into a trunk, not typically covered by Medicare or insurance. So we buy a lot of those. We couldn't keep up demand with shower seats with backs and arms. Most physical therapists and occupational therapists, if you are having knee replacement or you need help in terms of balance in the shower, they don't want a shower stool or a shower with seat with a back. They want a shower seat with backs and arms. We bought several hundred of those last year. So just to give you a sense of the numbers, we put aside a certain amount in our budget. For this year, it's $70,000. For last year, we spent $60,000 to seed our library, to buy things when we needed them, and we lent out about $1.2 million of equipment. So it's really about 5% is what it costs us to have our library running smoothly. People can come, they don't need to call us back because we don't have equipment. And we think that that makes a lot of sense. Um, just as another statistic is, for every dollar that our library spends, which includes seating our library, which includes our rent, we're mostly volunteers, but we do have a couple of operations managers who we pay. For every dollar we spend, we lend out about $4 worth of equipment. So our budget last year was roughly $300,000, and we lent out $1.2 million of equipment, which, why wouldn't you want to do that? Which begs the question, a lot of these places, there are about 5 to 10 places in Fairfield County in Connecticut that have closed over the last 5 to 10 years. So how could that be? This is a good idea. It's low hanging fruit of doing good. Why would these places close? And again, our belief is that resources for low income people and for the poor are built out differently than community resources. So the town of New Canaan just spent $40 million to build a new library that lends out books. And I'm sure it's beautiful. I'd like to go there. I think that they probably have one of the greatest water fountains that, I could ever even imagine. And that's a community resource, and everybody uses it. When you talk about lending closets, they're typically a resource for the poor and for low income people. And they're typically run by a couple of people. And if one of those people moves to Florida or something like that, the place closes. The other reason these places close, which is true of the visiting nurse service of Newtown, which had a lending closet for over 50 years. And their insurance company did, they do, somewhat routine audits. And at some point, the visiting nurse service of Newtown does a lot of things. They do 5 or 10 things. They provide nurses, they provide visiting people who are sick, maybe Meals on Wheels, and they had this lending closet for 50 years. When the insurance company focused on it, they said, keep doing everything else you're doing. Stop doing the lending closet thing. So it's a liability thing, and you need the right type of insurance. It's not a typical not-for-profit insurance policy. There's a women's auxiliary group in Westport that also used to do this, that stopped doing it because they lost their insurance. Um, there's a place, Hospital for Special Services, which is in New Britain, Connecticut. They did this for many years. They closed during COVID. They never opened up. The American Red Cross in Greenwich used to have a lending closet in Greenwich. They stopped doing it. Exactly why, I'm not sure. River House in Greenwich, which is a senior center. They used to have a lending closet, literally in a closet. They needed that space for other things. They stopped doing it. So the reason we're doing okay so far is because we're kind of a standalone thing. If you're a bigger organization and you're doing DME, durable medical equipment lending, this takes up a lot of space. We have about 1,000 things moving in and out of our warehouse every month in Stamford, and soon we'll have that in Bridgeport. Um, and it takes up space, and it's heavy, and it's big. And this is likely to fall off your radar if you're not just focused on this. So our goal has been to figure this out. We still feel like we're learning every day. Um, and we launched the Stamford location. We feel like we know enough now to have launched the Bridgeport location. We're adjusting our technology in terms of our inventory system to handle 2 locations instead of 1. We're, using our phone system, more strategically now that we have 2 places rather than 1. And our goal is, eventually once we figure this out, what we say is we're coming to a town near you. Because this is an unmet need in most places across America. And it's not, there are some societal problems that are very hard to solve, whether it's homelessness, whether it's, drug addiction and things like that. This is a fairly easy problem to solve. And it's green, right? So we've kept, hundreds of thousands of pounds from ending up in landfills. And we also, I'll just mention, and apologies, this always turns into a rant. We treat ourselves as a community library. So there's a lot of community outreach. So for example, in Stamford, Hazardous Waste Day, which I'm sure there's, in every town in America, has turned into Hazardous Waste Day and DME Collection Day. In the town of Greenwich, we have at the town dump, I think it's called Holly Hills, they've given us our own dumpster there. It's a covered dumpster where people who have DME that they're bringing to throw out can put it in our dumpster. We will take it out. We will clean it, sanitize it, inspect it. And other people can benefit from it. We just were at the Bruce Museum in Greenwich for MLK Day, where they were doing projects. And so we have Wheel It Forward clubs in several high schools, local high schools around the area. We have students from Build On, which is a group that tries to keep kids in school to graduate high school. We have volunteers from Ableist who come multiple times every week, people with disabilities, to help us sanitize equipment and help us out in our warehouse. So we're not just, taking in and lending out durable medical equipment. We're looking to really include the entire community in this. One of the questions we asked ourselves when we started, it's okay to call yourself a community library, but would somebody who could afford to buy this stuff, would they be willing to borrow it and maybe make a small donation, and then return it when they were done? And our team doesn't fight about a lot of things, but the most heated arguments were, nobody who could ever afford to buy a commode or a toilet riser seat would ever want to borrow one from you. And probably about a year into this, I was coming back to our Stanford our Stamford location. And I have a friend, his name is Bob, and Bob can afford anything. And Bob is walking out of our warehouse with a toilet riser seat because he is having hip surgery and he knew he was only going to need it for a couple of weeks. And he came to borrow it. And by the way, that toilet riser seat has been steamed, it has been sprayed, it is cleaner than if you go to the finest hotel in the world, whether it's a Marriott or a Four Seasons hotel. It's cleaner than, the toilet that, you're using that somebody else was using yesterday. Apologies for maybe too much information, but it's true. And so the fact that people will borrow stuff who could afford it is very important because what we call velocity is very important to us. In other words, we need stuff coming in and we need stuff coming out. And when either of those things, kind of are not in equilibrium, all of a sudden you could sense it, like the tide of equipment is coming in, but it's not going out, or vice versa. And so probably about 3 months ago in Stamford, we realized we had only like 10 wheelchairs in the warehouse, and we're lending out about 80 or 90 wheelchairs a month. So we bought 20 wheelchairs to, kind of smooth over that ebb and flow in things. And so that kind of works. And so the fact that the whole community is aware of us, could use us as a resource, knows about us, is quite powerful. So last year, and I'll end with this, and happy to take questions. Last year, we had a total of about 6,000 people use our library to either borrow equipment or donate equipment. And that's almost 2% of all households in Fairfield County, or, that sort of thing. And so that has been very powerful in terms of spreading word of mouth, because as we who drink the Kool-Aid say, um, if you've donated equipment to Wheel It Forward, you're definitely going to tell one of your friends about it, right? You're just definitely going to do that. Or if you've borrowed stuff from Wheel It Forward, you're definitely going to mention it to a friend. So really, word has spread fairly quickly, and that has been powerful. And so again, if a resource is built out for the community, it looks one way. If a resource is built out for low income people, sadly, like the terms used most often at a loan closet is, we don't have that now, but call us back, check in again and we will get it. And that's, society says that's okay, because that's just the way it is. And what we believe and what we know is, for the want of 5% of everything we're lending out, which is 4 times the amount of every dollar that we spend, we can have a smooth running community library that helps everybody when they need it, to keep them mobile and safe at home. So I'll just talk about this slide, which Amy put up on the screen. Again, we track data pretty much regarding everything. And this is, gives you a sense since inception, our growth rate and what we've been doing. And, we're keeping, a couple of 100,000 pounds. This is through November. Obviously, the numbers are higher now. When, you see the amount of stuff we have in our inventory, which is being blocked by my thing here. So, we lend things out again and again and again. So, if we buy a transport wheelchair, we've had transport wheelchairs that have been lent out, 5 or 10 times in a year. Some people only need it for a day if they're looking to take grandma to a wedding, where she'd have to walk for long distances, but she doesn't typically use a wheelchair. But, why not borrow one for a day or a week or whatever? So there are a lot of use cases for what we're doing. And, again, we keep learning more every day. The last thing I'll say before taking questions, and apologies for the rant, is our team has what's called a blank slate mentality. In other words, we feel like we know nothing for sure, right? Every day's new. We don't know what's going to happen. But the one thing we know for sure is that more of us will need this equipment at some point in our lives than will ever walk into a library that lends out books, which is to say, we're all going to need this stuff at some point, probably multiple times. And if it's, somehow we're lucky enough that we don't need it, a family member is definitely going to need it. And so our dream is one day you walk into a community and there are two community libraries. One lends out books, one lends out durable medical equipment. They're both built to scale, right? They could handle the opportunity. Um, and everybody knows where they are when they need it.
Thank you, Elliot. Could you talk a little bit about how people can see if you have the kind of equipment that they might be looking for, then how they would get it, how that sort of process works?
Sure. Thank you for reminding me about that. So, it's 2024 and
Mhm.
um, our website, based on whatever else is out there, is is not that novel. But our website, compared to what other lending closets have, and most lending closets don't have their own website, they're just mentioned on a different website. So the ability to come to our website at Wheel It Forward, you there's a tab that says borrow equipment, and you could check our inventory. You could see our inventory in Stamford. You could see our inventory in Bridgeport. Um, After that, you could join our library. It takes 2 minutes, just ask basic questions. And then you could actually reserve the equipment if you'd like. Not everybody's tech savvy, but you could reserve it to pick up on a specific day. Sometimes we can provide delivery services. We always deliver hospital beds because we want to know that they're installed correctly. Um, we've had people, a loan closet from Vashon, Washington, which is pretty exciting to us just because it's all the way on the other side of the country, and they've been at it for 10 or 20 years. They called us up, and the woman there, who is wonderful, she left a voicemail and she was like hyperventilating about, like, she just can't believe that this could ever exist in terms of our website. She had stumbled upon it. So we're open to sharing all of our technology, everything we're doing, and we have convinced probably 5 different lending closets over the last 5 years, excuse me, over the last 2 years, to start using our inventory management system. And when I say ours, we didn't build it ourselves, but it's kind of an off-the-shelf product that just makes a lot of sense. And so that inventory management system plugs into our website, which enables a user to see what equipment we have, what's available. One thing I'll mention is, so I mentioned we always have 10 categories of equipment. And it's rather basic equipment, the things people need most. We do have very often recliner chair lifts, which are a very powerful piece of equipment that could really help people. Um, that's not the type of thing we would usually buy, but we usually have them, and if we don't, it's a very short wait time before we get one in. And so what we tell people is if you don't see something on our inventory, you should call us, because things move in and out so quickly that that sometimes something goes out and it doesn't get taken out of the inventory, like, that minute. And then very often we have other things available. So it's a pretty simple process. Our business model is we ask people for suggested donations related to each item. So for example, a wheelchair is $75, but it's totally optional. There's never any pressure. About half the people make somewhat of a donation, and then the other half makes no donation, and it's fine with us. People can use things. Our system defaults things to 6 months borrowing it for 6 months. But what we tell people, which is true, they're welcome to use it as long as they need it. And there are things we know that we are not going to get back. So for example, we have nice relationships with the local hospital systems. They call us all the time. If they need to discharge somebody from the hospital, it saves them a fortune to be able to do it in a timely fashion. And so Stanford Hospital, Bridgeport Hospital, just a couple of weeks ago, they had a patient who was from Mexico who got hurt in Bridgeport. He'd been in the hospital for about 3 months. He needed a tilt in space wheelchair, which is a more sophisticated piece of equipment. And by the way, that was going back to Mexico with him. So we're not getting it back. And that's okay. Because as I spoke about before, we need velocity. We need stuff coming in and we need stuff going out. And so even if we're not getting it back, that's okay. That's okay with us.
When I come to finish it, you don't
Uh,
need to, this is not exactly what I was.
Sorry, I'm
Amy,
not sure what that was.
oh, that's okay. Did, if there are any other questions, I'm happy to answer them.
Can you talk a little bit about people donating to your organization equipment-wise, what that kind of process looks like as well?
Sure. So that's also pretty easy. If it's a hospital bed, we like to see pictures of it because we can handle like 90% of home hospital beds. But strangely, if somebody has a kind of a very high-end hospital bed, those are very hard for us to handle. They weigh hundreds and hundreds of pounds. They're very sophisticated. And we don't have the space or really the know-how to really handle those. We do pick those up. The hospital beds that we can accept, we prefer to pick those up. And we pay to contractors who do that, who both deliver and pick up hospital beds for us. Um, things things like other power equipment, we power wheelchairs are difficult for us to accept. The batteries are very expensive. The maintenance is very expensive. We will take them occasionally if we feel comfortable that they're in excellent condition. Um, we accept power Hoyer lifts, and power sit-to-stand lifts and things like that. And again, before we lend those out to people, obviously not only do we sanitize those like we do everything else, but we have a professional person inspect that. So a basic wheelchair, our volunteers are trained to check the brakes. We have people who could tweak the brakes and that sort of thing. But especially for power equipment, we want to make sure that it's gotten inspected and is ready to go.
Other questions, anyone? How about how Wheel It Forward works, equipment in general? What?
Well, Amy, you took both of my questions, which were going to be, is there any equipment you don't take? And about, actually, you didn't ask this one, but Elliot, you answered it at one point with deliveries and pickups of equipment. So I have my big questions answered. I just wanted to say thank you. I think what you're doing is absolutely incredible. These numbers are amazing. Being at this organization for almost 13 years now, I will say in the beginning, we had a garage here where we stored all of our equipment. That was the loan closet. And, it's come such a long way. We've learned so much about how to properly take care of it and how important it is to sanitize everything, make sure brakes are safely screwed on, and even height. I remember there was a few times where it was, well, Jackie, you're tall, sit in this chair, let's see if this would work for this person. And we did the best we can, but there weren't many resources out there. And I think the idea that you said for every community to have 2 libraries gives me goosebumps, because this is such a need. And it's something we hear people call us all the time from the general public saying that they have equipment. And they're like, what do you mean? Like, you can't take this? And for whichever reason, if we couldn't take something, and it feels like it's such a waste. So now to be able to have someplace to refer people to has been a tremendous resource for us. So thank you. I'm cheering you on. I hope we get those 2 libraries per community. Definitely needed.
Thanks. So at one point you brought up was like equipment that we don't take. We don't take any oxygen products, oxygen related products. Um, a lot of other things we might take, but what we tell people, which is true, we'll try to get it to another not-for-profit. So people, for example, sometimes donate readers, like they're a big box machine that it's like a magnifying thing. You put the book underneath it and it comes up on a big screen. So, just over time, we know where to get those. So we get them to a local public school or we get them to the Lions Club and things like that. So in essence, we become like a little bit of a hub because we know where things can go. I'll also say, the healthcare market and industry in almost every town is very fragmented. You've got the hospital systems, you've got the PT and OT groups, you've got the surgical centers, you've got home healthcare people. And one thing that we've discovered is use cases like, wow, and we have the agency on aging, Wheel It Forward really connects all of these different groups, the ALS Society, all of these groups. And it's kind of our responsibility at this point to figure out how to be most impactful given that. So, we have people come in, they're elderly, they're low income, they have needs, they don't have great access to information. We can give them the number for SWACA, Southwest Connecticut Agency on Aging here in Fairfield County. They have a hotline number, boom, that opens the door to their, getting services that they would have never found. We do refer people obviously to the ALS Society all the time. And it sometimes surprises me that people don't just reflexively reach out to you, when somebody has a diagnosis or even somebody who's fairly far along in that, but they don't, and they don't know or whatever it is. So we need to figure that out a little bit more. And we have what we call a healthcare advisory network. It's over 100 PTs, OTs, discharge planners, who we kind of connect. And sometimes we get a piece of equipment that's unusual that we know will stay here for a long time unless we blast it out to the community. And if we do that, invariably somebody will benefit from it versus it just staying here. And things that just sit around here is not a good thing for us.
If someone wants to donate kind of just the basic DME, maybe like, wheelchairs, walkers, commodes, are they able to just come and drop it off, or do they need to make an appointment or just come during business hours?
Yeah, so it's really just coming during business hours. In our Stamford office, at the very bottom of our website, there are a bunch of links. And one of them is directions to Stamford and or to Bridgeport. In our Stamford office, things can be dropped off 24/7, literally. They're, they can be left outside, kind of weather dependent. If you're dropping off a shower seat, those are meant to get wet anyway. In Bridgeport, it's more our office hours, which are Monday through Thursday, 10 to 3. The truth is, on Fridays, it would be easy to drop something off also at those hours, because there is somebody here. So yeah, I mean, we make it pretty easy, and believe me, we come in on a Monday morning, and there is stuff at our door. And right now, not strangely, we have a lot of disposable items that people donate to us. And again, there's somewhat of an ebb and flow to that. But like all of a sudden we have, 30 cases of stuff in Bridgeport, we have 30 cases in Stamford, and we needed to move. So again, people come in, they could come in just for that and just take what they need. They could call us to make sure that we have the size they're looking for, so they don't have to come in, if we don't. But yeah, people come in, they borrow equipment. Sometimes they realize the loved one could use some of those other things, and they just take it.
So people have an opportunity to just go and kind of like shop around or like look at stuff, touch stuff, sit in stuff, that kind of
Yeah.
thing.
So we have everything from unused hygiene things that are obviously sealed and stuff like that. We've run into an organization called Magna Ready. I don't know if any of you have ever heard of it, but it's basically clothing, um, very nice clothing, that has magnets instead of buttons. It looks like there are buttons, looks like a normal shirt or sweater or whatever. And so for that, they give us some stuff. We just show it to PTs and OTs, or family members if it could help their family. One day, when instead of having 2 library branches, if we have 30 library branches, then maybe we start selling that, as something that people need. Right now we don't sell or rent anything. But in terms of use cases and in terms of making this more self-sustainable, the idea of, you know, how can we make this self-sustainable and more impactful for the community, is what we're trying to figure out.
Are there any other questions? I don't see anything in the chat. Do you have a question? Sure.
I've got a couple of quick ones, I guess. Elliot, I came in about 5 minutes late, so if you gave a little bit of your business background, I missed it. Love to hear about it. Your presentation today, I think, was excellent. And the other is you have a $300,000 operating budget, I think you said. And how much of it comes from different sources?
Good questions. So my business background is I worked on Wall Street for about 30 years.
Okay.
And what I've learned in the last 3 years is I never really worked a day in my life. In hindsight, that wasn't work.
Right.
And I was involved in a startup, which what I tell younger people is like everything you do kind of builds on the next thing, and that experience is worth a lot. So I worked on a kind of a tech startup for a while. I've written a couple of children's picture books, and one of the catalysts for all of this was I've always been a fan of the library, and even as a young kid, my mom would drop me off at the library, and I'd spend 4 hours there and read every magazine, like Tropical Fish magazine and politics magazines. So I always believed that there was another great idea out there, like a book library, but it didn't involve books, right? I didn't know whether it involved lawnmowers or whatever. And about 5 years ago, I was asked to chaperone an 8th grade trip from a local school that took their students to Israel for a month. And so they asked me if I would do it. My mother said, well, of course they asked you because you wouldn't charge them anything. I would say, thank you for that vote of confidence. And I told them I was honored to be asked, find somebody else. And they found somebody else. And 2 weeks before the kids were going to leave, that somebody else bailed out. And then I had to go. And because of that, I ran into this organization with the students in Israel that does this. And so I was sitting at that presentation and watching what they were doing. And it was like a thunderbolt moment where it's like, this is the library but it doesn't lend out books. It's something else. It's something called durable medical equipment. We've been fortunate to not need a lot of it in my family. And so that's when we came back here and did the deep dive. And there's just an unmet need in a for-profit business. You need to keep innovating. Otherwise, somebody is going to come along one day and eat your lunch, right? Like, so whoever said at Kodak 20 years ago, no, we think that the camera should have film in it, right? We don't believe in this other stuff. That's great. They're really, Kodak doesn't really exist anymore. In the not-for-profit space, nobody wants to rock the boat too much and maybe take risk, because that reflects poorly. You're not supposed to lose money or, do things that are out of the box in the not-for-profit space. So you may have heard Apple Computer, or Apple just decided to ditch their electric car, right? They'd been working on it for probably a decade. It's priced at billions and billions of dollars. And I said, we're not gonna do it, right? It all goes away. But people in the not-for-profit space don't have that ability and that flexibility to try something a little bit more audacious and see if it works. And so that's what we're trying to do. It still makes a ton of sense, just based on the economics of it. And in terms of your second question, so right now we think of how we fill that $300,000 number into 3 buckets. About a third of it comes from suggested donations, where, as I mentioned before, that's kind of our business model. We keep tweaking the business model to get us where we need to go. We're trying to push the envelope, not because we're trying to make money, just because we're trying to be self-sustaining. So when we started this 3 years ago, our suggested donation for a wheelchair was $20. Then it was $50. Now it's $75. Half the people pay it something and half the people don't pay anything. But for the people who can pay $75, they do. Every once in a while, somebody walks in and instead of paying $75, they'll write us out a check for a few $1,000s. And, that's always very appreciated, and that happens. So a third of it is from suggested donations. A third of it is roughly from grants. Places like United Way or Rotary Club or Lions Club, or a community development block grant from the town of Greenwich or Norwalk, in these different places. That has been wonderful for us. And as we learn about grants and fundraising in general, it's very time consuming. It's time consuming to get approved, as you all know, smiling from the ALS team. It's time consuming to get approved. And then once you get approved, well, that feels great. But then to get the money requires an entire additional layers of reporting. And that's time consuming too. And then the third bucket is we've really done just one annual fundraiser, like end of year fundraiser, where we beg our friends, family, neighbors, and people who use our library to support us. So we don't spend a lot of money on glossy flyers and mailings and stuff like that. It's been rather simple. But the other thing that I mentioned along the way is, we touched 6,000 people last year. People who borrowed equipment or people who donated equipment. So we do have, 6,000 email addresses. Not everybody has an email address, but and so in terms of our end of the year fundraiser, we do have the ability to put out a blast. There's a place in Pasadena that is doing what we're doing for 100 years, which is pretty amazing because very few for-profit companies or not-for-profit companies have existed for 100 years. And they have, 30 or 40,000 names, and they cover their roughly $800,000 or $900,000 budget because they don't have as many volunteers as we do. Largely by donations of $20 and $30 at a time. And, they obviously know what they're doing because they've been at it for a long time. So that's our goal, is to get there. Another one of our goals and our challenges is that, we're kind of a startup and we're really, we need to invest money, whether it's in technology, whether it's in marketing, that sort of thing. And so, we need more money than it is just to simply run the library. So it's going to cost us somewhere between like $200,000, around $200,000 to run a branch of Wheel It Forward. But at some point, and again, we're volunteers, at some point, if we really want to go from 2 branches to 100 branches, you kind of need to build out that corporate piece where you have your own technology person versus just a volunteer. You have your own marketing person. You have your own CFO and CEO, which are all being done, on a volunteer basis now. So we've been fortunate, we know what our expenses are going to be. We've been pretty close on our expenses, which is not to be taken for granted in a startup. And then whatever our expenses are, we just say, oh, okay, well, we'll raise that much money. And miraculously, somehow we have raised that much money. But we need to get better at that. And we're hopeful that over time we can figure it out.
Thank you.
Thank you.
All right. Anyone else have a question or that? All right. If not, I am going to say thank you so much, Elliot. We really appreciate this. Oh, we'll have this recording up available for people and share that out. And if you have any questions or need to know how to get a hold of Elliot, let me pop the contact information up one more time, just in case, so everyone has it there. And it will be on the recording as well. So thank you all for joining us today. Get a few more minutes back of your day, and we appreciate it. Thank you so much, everyone.
Yeah, thank you all. Thank you, Amy.
Thank you, Elliot.
Yeah,
This is
be
so
well.
cool. I'm ready to open up the third one. Let's go.
Okay. Be very careful. We take people